Okay, good day to everyone. BSN21. We will hold our synchronous session for this afternoon. And our topic for today is all about nursing informatics model. This topic of nursing informatics model will entail and cover learning objectives that will uh, consider how nurses will be involved in the use of technology. We have discussed already the concept of data, information, knowledge, and wisdom through the DIKW pyramid. And with the basic knowledge of the data, information, knowledge, and wisdom, the nursing informatics model will expound more on the how nurses will consider its relevance, the nursing informatics, the health informatics, the e-health as our responsibility and our accountability in terms of healthcare delivery system. But first and foremost, again, I would like to ask everyone if you have any clarifications on the lessons that was discussed last week on asynchronous mode. If there are no questions or clarifications, can I see thumbs up so that I could be more confident that that you understand our lesson last week. Can I see thumbs up? Or if you have any clarifications or questions, you may use our or maximize the use of our chat box, or you may unmute yourselves. So some have clicked the thumbs up, meaning majority do understand the lesson that was discussed last week on asynchronous mode. Now, let us start with our discussion on a question that will explore everyone on the discussion and connect it with the nursing informatics model. So, do health informatics initiatives must be a priority project of the government? If yes, why? If no, why? There are no wrong answers in this question. You may just visit or join at slido.com with the code 3798127. Again, our core question for this evening or for today's topic is, do health informatics initiatives must be a priority project of the government? If yes, why? If no, why? The overview of why I asked initially this question in our topic on nursing informatics model, because the topic that we will consider for this afternoon will basically emphasize the roles of nurses and responsibilities of nurses aligned with nursing practice, aligned with research, aligned with the clinical decision making, and even in the education and administrative functions. So again, if you wish to respond, all of your responses are recorded for those who have responded. Although it will consider an anonymous for your identity. However, all of your responses will be accounted and recorded so that it could be very useful for our discussion on the later part of the topic. So again, visit that and join the slido.com with the code 3798127. Okay? So while waiting for your responses, um, probably each one of you have experienced the and observed even with our previous discussion, you have observed some of the issues and challenges in the healthcare system of the country, from barangays to the city to district, provincial, and even on the national level. Upon your observation, you have mentioned in the previous discussions that most of the affected areas are the communities, which basically considered public health. So with this observation, let's go back to the question. Do health informatics initiative must be a priority project of the government? If yes, why? If no, why? So again, I would like to reiterate that there are no wrong answers in this question. Your responses will be very meaningful and useful to explore discussions and extent of how you analyze the picture. You can have an imagination, or probably you may project yourselves as future public servants. If you will be in the position, will you consider health informatics initiatives as a priority project within your locality? So let us now read those responses. Yes, because it improves patient cares and health outcomes through the efficient and effective use of data. Correct. Because eventually you have considered the two terms, which is very important, the efficient and the effective use of data. If we say efficient, we are considering on how you have maximized the available resources. And the effective use of data is basically the outcome. And what could be the outcome? If you have maximized all the resources through the information that you may have, through the principled use, through the use of the principle of health informatics, the effective use of data is considering the impact. And probably this information, as you maximize these resources, help the patient on the prevention of complications. So those are basic situations. So another response here is yes, because it minimizes the need for a drawn out coordination process. So this is a good response. If we say drawn out coordination process, this will involve a collaborative effort, collective decision making on a timely response to every health emergencies or situations that will require immediate medical attention. As mentioned, it will accommodate new treatments and procedure. Yes, because it may access to the new research findings that will be used as evidence-based in clinical decision making. I'm very impressed with your responses. Continue to post your responses. As we check on the basic terms that have been highlighted in this question, number one is we have four that has been associated with patient. Yes, because patient is the core beneficiary of these initiatives. Strategies as well is the one that will be considered on how we will meet those objectives of health informatics, and data are very significant when it comes to its processing. So let us read other responses here. We have yes, to maximize our resources to achieve the utmost holistic care of the patients and community. We all know for a fact that nurses have been oriented on the discharge of responsibilities, not just only for individuals. Kaya dapat tayo, we are exposed into and immersed into the training on how we will maximize the knowledge, the skills, and attitude on individuals, families, and community. So the across lifespan and in varied setting. And I think the utmost holistic care that you're probably considering here in the use of the health informatics is to have a timely and updated information that can be used for promotion and prevention of illnesses, and probably if there's an existing health disequilibrium, then immediate response or attention can be given on an appropriate and proper time. So let us now read another response here. Yes, because it uses technology and information to advance strategies. The one I think you are now referring to public health, right? Because the use of the information when it comes to surveillance, it applies on situations like outbreak, endemic, pandemic, and basically the electronic laboratory reporting, results of diagnostics and laboratory examination to facilitate, for example, even in the time of COVID-19, it can facilitate dissemination of results to identify confirmed cases of COVID-19. And I think this will help uh, individuals, families, and even the whole community on how they will consider a priority initiative for the prevention of spread of infection. So those are examples. Thank you for your response. Yes, another response is advancement strategies in the community is important for prevention, preparedness, and health promotion. Those response, I will just capture one, which is preparedness. One of the concerns in the community is basically our indicators of success. Every time that we do health education and implementation of basic health services. And one of the concerns that we have encountered in most of the communities are problems uh, with mortality and morbidity during disasters and calamities. In spite of the reminders and information campaign, so I think the health informatics can really help in this perspective. So most of you have answered in favor that you will consider this as a priority project. And if it is considered as a priority project, it will consider also the appropriate allocation and budget for funding. So let us proceed with other responses. Yes, to have advanced strategies and management, because again, if we are talking about strategies, we are envisioning of what will be the healthcare system. And I think this will help realization of individuals, families, and communities, and even healthcare providers on how to maximize resources and the need to adopt already initiatives on health informatics. Yes, there are lots of benefits for both nurses and patients, correct? Because it was mentioned in our workshop today that most of the healthcare providers, almost 73%, nurses are the ones in the front line in the execution and implementation of e-health initiatives. And who are the beneficiaries? Basically, the patients. And the patients must know this information so that to avail the services and to have the mindset that there's always basic health services that are available in the community. So it's just a matter of using the technology, maximizing the use of resources that every individual has, just like mobile phones, Android phones, and even any other means on how to access information. Yes, because having data can be helpful in future healthcare plans. Yes, what we are doing now is most of the e-health strategy ended up in 2020, and we are now considering the framework on how we will set the roadmap for the next 5 years up to 2028. And yours truly have been involved in the crafting of the and conceptualizing the roadmap of e-health for 2028. Yes, because it will help improve healthcare system in general, because it could be two-way. The healthcare providers, the healthcare facilities, and even the communities will benefit. Yes, in my opinion, the government should prioritize health informatics since it will help to enhance public health. I think in our last activity, uh, you have considered public health as the priority area to consider implementation of health informatics, and most of the manpower that are deprived are the communities, lalo na sa mga geographically isolated disadvantaged areas. So I think to prioritize health informatics in the community level, uh, the information technology is a way on how we will reach individuals, families in the communities. So let's go back to the terms that have been highlighted in this question. So number one is still the patient as core beneficiaries of healthcare. Healthcare, as we are in particular talking about the system, and strategies, which we are talking about initiatives. So probably I may call two students to share their insights on this question. Or probably you may volunteer and raise your hand to share your insights about this question. We acknowledge, or I truly acknowledge and appreciate the responses or those students out of 21 students in the Zoom room who have responded in our initial interactive session question. So, since no one is raising their hand, so probably I may be calling from our Zoom room. May I ask Christian Dale Taknyo?
Yes po din.
Yeah, Christian, what can you say about this question? What is your response? Is it a yes or a no?
Actually, Din, I have answered na po dyan. Sa akin po yung pangalawang answer po sa baba.
Okay, so that is on it minimizes the need for drawn out coordination, am I right?
Yes po, Din.
Yeah, so can you explore it more? Kasi I know that even the World Health Organization have emphasized, even here in our training, the importance of coordination as a process of reaching uh, the communities and individuals for services. Can you expound it more on your answer?
Ano po, Din? Wait.
Your response is on yes, because it minimizes the need for a drawn out coordination process between various healthcare workers and allows healthcare practitioners to accommodate new treatments and procedures.
Mas makakatulong po kasi yun din para po ma-reduce rin po yung chance of medical errors po in a healthcare system.
Mm-hmm. Yeah, that's correct. Because probably the available information can be accessed by those authorized healthcare workers who may attend to the patient for consistency and transparency. That's good. How about you have mentioned here that it can accommodate new treatment and procedure. How it will benefit the health practitioners if there will be an established health informatics?
Ano po? Kasi I think kasi po with the use po of of with the use po of siguro computer po parang mas makakapag-explore po, mas makakapaghanap po ng mga bago pong medications na pwede pong
Mm, correct. So it's somehow you are talking on the perspective of updating, acquisition of new information that could be useful for more efficient and effective discharge of treatment regimen, supportive measures to prevent complications. Thank you, Mr. Christian Dale. Salamat
Thank you po
po.
din.
Okay, so I may call on another one po. Again, you may volunteer, you may raise your hand or unmute yourselves so that nawala na, naging 18 na lang tayo. 17, ba't nababawasan tayo? Okay. What is happening in our Zoom room? Okay, we are now only 16. What happened to the others? So, may I call on, how about Cheryl, the class president. Cheryl or Ms. Bautista, can you share your response on this question? Ms. Cheryl? My apology that we missed the connection, but we'll continue. Okay. Now let's go back to the responses. Okay, I actually asked about Ms. Cheryl. Ms. Bautista, can you share your insights? So probably she's having a connection problem. How about Kevin? Mr. Kevin?
Yes po din.
Yes
Hello
po.
po.
What can you share naman on this question of prioritizing health informatics as a priority project of the government? Have you answered yes or no?
Yes po. Ako po yung unang sumagot po.
Yeah, good. Okay.
Opo.
So you have mentioned about yes because it improves patient care and health outcomes through efficient and effective use of data. So can you explore on this or can you set an example on this?
Yung for example po nung efficient and effective use of data po. Kasi for example po, pag naka-store po yung data ng mga patients po sa computer or sa database, mas madali pong ma-access ng mga healthcare workers yung information ng patient. And then, dun po, dahil mas efficient po yung at madali po nila na-acquire yung data, mas madali po nila ah, magagawan po ng or mas madali po nila ma-achieve yung outcome na kailangan po ng patient. Yun
Yeah,
po.
correct. Siguro we can set an example here. For example, um when you receive an e-prescription and probably you wish to identify the nearest pharmacy or pharmaceutical facilities where the drug is available. So probably if health informatics are already established in the level of the community, so we could actually manage efficiently on the time. We can manage if we at the same time we can consider cost efficiency because of the expenses upon travel and other expenses for transportation, because it can already identify and you can already budget your expenses whenever the drug is already available. So I think that's one that we can consider. Thank you, Mr. Kevin. Now let us continue with the rest. We are now again 19 in the Zoom room, and we will continue on how nurses, ayan, how nurses have been identified as as workers, acquirers, users, engineers. Because let's go back on our discussion pertaining to the data, information, and knowledge. We have mentioned that data is meaningless, has no specific meaning. Then the information, it has already a specific meaning, and it becomes a knowledge if the if we have learned and expound the use of the information on a specific situation. Now, these are experiences. This could be acquired by experiences. However, we consider the wisdom as a way when a nurse will decide in the future, and probably those experiences with the acquisition of data, information, and knowledge will be useful so that to prioritize, it could be to identify the appropriateness of intervention. So those could be on wisdom. Now let us consider ourselves nurses as we greatly consider the acquisition of our competencies to have knowledge, because it serves as our foundation when it comes to decision making. Whenever we prepare a nursing care plan, we always take into consideration that we really need to have an information and use our knowledge so that it will align whatever information had been identified from the subjective data and objective data will be useful and appropriate in the formulation of your nursing diagnosis, planning, which is specific, measurable, attainable, realistic, and time-bound, and intervention. Its appropriateness is very important because as we go back to the data and information available, nurses are generators of informations. We are information rather. We are using this information and we set it as a knowledge so that it will be very relevant for the patient's appropriate treatment regimen or care plan. Let us start off number one, knowledge workers. Okay, as nurses, we are considering ourselves as knowledge workers when we are generating information. Okay. Once we generate information, it will serve as a knowledge. So, sir, can you give me an example on this? For example, when you are facilitating an activity, a hospital activity in the outpatient department, you need to complete the information needed in the data sheet of the patient. The information is very relevant so that it will help our nurses to identify any factors that may possibly deviate vital signs. Example, when when you identify through the information that the patient is more engaged into physical activity as an athlete, okay, we expect as based from what you have learned. Kasi the knowledge could be experiences, could be a source of what you have learned from the past learning sessions. You have learned that those athletes or those individuals who are more engaged into physical activities, most of their heart rate are lower than normal. So with that knowledge that you have identified from a specific reference, you may not think of an alarming situation to that athlete or individual who is engaged into physical activities and have the what we call bradycardia, because it's a normal response of athletes when they experience bradycardia. So you will not be alarmed. You may not support any immediate measures or emergency measures to correct the deviation of bradycardia. So why did you decide that you will not consider it as an alarming situation? And yet it's below 60, and that's bradycardia. Anytime the patient will have cardiac arrest because of the evidences, because of the information and the knowledge which you have learned from the legitimate sources and experience that on your actual immersion to clinical areas, that most based from the the references and literatures, athletes experiences bradycardia. However, it's not a matter of ignoring the situation of the patient who is bradycardic, but initially when you take the vital signs, it's normal when you ask it in the patient history. Di ba, you generate the information, this information, you come up on the processing of the knowledge that you have learned, and that comes on a result on how you will behave in that situation, on how you will react in those situations. Sir, another example, knowledge workers. As when you generate information, for example, newborn. Okay, for newborn who is scheduled for a pediatric consultation, then the information that is very relevant and very significant that you may ask is immunization history. So probably you may expect and check or even ask, even though you may not still have the patient data sheet or profile sheet, you may ask, ma'am, how many months old na po is the patient? 5 months old. So probably you might think of those knowledge that you have knowledge or information that you have learned before, or knowledge that you have learned before on what are those uh, vaccines or immunization that the patient or rather the infant have already received. So probably you may ask initially BCG. Okay, so that comes from not from anyone, that comes from your knowledge. So you are basically identifying the infant, the age of the infant, the knowledge on the immunization, and the specific immunization that you will ask. Whenever you are digging on questions to verify information, to validate information, you are considering yourselves as knowledge workers. Okay? Now, next is you may consider yourself as knowledge acquirers from the term self-acquire. Okay? Nurses are knowledgeable in terms of the highlight in this definition of knowledge acquirer is efficient means. Okay? What do we mean by efficient means? If, for example, there could be two situations in a government or in a private institution, depending on the processes that have been involved in data gathering. There are some hospitals that has an established hospital information system. So, meaning if there is a hospital information system, what could be the efficient means of storing knowledge? So, what you will do is that of knowledge that you are considering here is that of you have already the data that is already indicated in the hospital information system. All you have to do is to fill it with information. Once you fill it within the information, then it will be stored in the system. Now, once you endorse the client from the emergency room to the ward, you don't need to have the physical chart. All you have to do, all you can do rather, is to open the hospital information system in the ward and open the patient profile. Once you open the patient profile, it already stored there the information that you have entered in the emergency room and endorse it in the ward. While you are doing the endorsement in the ward, you are using the information that you have entered in that hospital information system, and you may endorse the patient's condition on the some of the possible deviations that the patient may have. So, sir, can I have an example? For example, vital signs. Knowledge acquirers. Okay, nurse enters the blood pressure 150 over 100. So very obvious that the patient is experiencing hypertension. The patient experiences nape pain. The patient experiences lightheadedness. Now, when the nurse will endorse the patient in the ward, then the ward nurse will receive the patient. The nurse will open the hospital information system and have the ward nurse the access to the profile of the patient. While you are doing the endorsement, how you will consider yourself as acquirers, because you're the one who entered the information, you're the one also who will use the information for purposes of consistent and efficient endorsement to the ward nurse. What the ward nurse can access is the same information that you have entered in the emergency room. What do we mean by efficient means? You have maximized your resources. You have maximized the available health information system and stored it in for the to store the information. Thus, you have used it as a knowledge when you are now endorsing the patient to the ward nurses. So in this perspective, the efficient means is you maximize all the resources to process all this information that is relevant to your role as a nurse. So that is knowledge acquirer. Next, how about knowledge users? As knowledge users, it is on how you considered what you have learned that will benefit and valuable to individuals or group. So, for example, you have identified in the community, in your community health nursing, that most of the elders aging 60 years old are experiencing um, rheumatoid arthritis. Okay. Now, how can you now take your role to individuals or group? What is valuable from that what is valuable with the information that you have gathered, that almost elders or aged with the age of 60 years old in the community have been diagnosed with rheumatoid arthritis? How can you use these knowledge users? It could be more valuable. It is valuable to individuals, since you have known that most of the patients aging 60 years old are diagnosed with rheumatoid arthritis. You will facilitate conceptualization of health education. And how you will facilitate health education? You will use all the available information for the 60-year-old patients or clients in the community to be aware and be informed about the cause of rheumatoid arthritis for purposes of promotion and prevention of its painful attack. So how we become knowledge user? How you consider yourselves as knowledge users? You have considered those information valuable, and you know that you can share also your knowledge to those beneficiaries of care, the individuals or groups. So let's go back. What's in now 1, 2, and 3? If you are a knowledge worker, you generate information. You have maximized your skills and competencies in data gathering so that it will be useful. As knowledge acquirers, you have used the information and available resources so that it will be used in our profession as knowledge to facilitate work related tasks. In number 3, knowledge users, you have identified information that will benefit individuals or group, that will make it more valuable. Valuable meaning that will benefit them for promotion and prevention of the health. Okay? So again, if there are questions, if there are clarifications, you may just raise your hand or put questions in the chat box. Next, how about knowledge engineers? If we go back, if you will encounter this term engineers, what will definitely pop in your mind? You will probably think of buildings, bridges, designs, and this will require a time and maximize your skills, focus on how to design buildings and bridges. Just the same as nurses are also knowledge engineers. For example, when you are working in a specialty institution such as San Lazaro Hospital. San Lazaro Hospital is a specialty institution or facility because it accommodates most of the clients who are diagnosed with communicable or infectious diseases. Now, when a nurse is assigned in San Lazaro Hospital, what is the foundation or knowledge that you expect and you will master when you will be assigned in specialty hospital? So definitely it's more on infection control. Now, during the time that there are situations that there will be outbreaks. If there will be outbreaks, nurses' role will be considered in the hospitals. For example, outbreak on dengue. Most of the patients with diagnosed with dengue fever or dengue hemorrhagic fever will be are admitted rather preferably in San Lazaro Hospital because number one, we have infectious specialists. Second, we have competent nurses who are trained to manage infectious diseases. In short, a nurse can facilitate and design plans that will project and even envision whenever there will be outbreaks of dengue hemorrhagic fever. So probably the nurse will review literatures in relation to management of dengue hemorrhagic fever. So from the term itself, dengue, hemorrhagic, most of the patients who are diagnosed with dengue hemorrhagic fever are experiencing bleeding. So what could be the design that the nurse will consider? First and foremost, since it's vector-borne disease, the dengue virus is carried by mosquitoes. So basically, the importance that the ward is free from these Aedes aegypti mosquitoes. Okay. Second, because it is dengue hemorrhagic fever, the nurse must be alert when it comes to availability of blood because this will facilitate possible blood transfusions to patients diagnosed with dengue hemorrhagic fever. So, sir, how can we be knowledge engineers there? I myself could be knowledge engineers. I specialize in infectious diseases, and it's already in my mind that I will design protocol if ever there will be admission or increase in the number of admission of dengue hemorrhagic fever because my ward are prepared. I am confident because I have designed I've designed a care plan. That's it. I have developed a care plan for the specific cases such as dengue, hemorrhagic fever. So how come health informatics comes in? As knowledge engineers, health informatics will be useful when you have admitted a number of patients. The maximum capacity, for example, bed capacity of the dengue ward is 20. Then the nurse will use the hospital information system to check in other departments if there are still stocks of blood with various blood typing. The nurse will check also the hospital information system that is connected to central supply room if there are sufficient supplies of blood transfusion supplies. So how do you design it? You design it accordingly as a plan because you are projecting possible blood transfusion. You are projecting that it will definitely need the stock of blood. So you are considering yourself as knowledge engineers. So design and develop. You already project it. You are already you can with your knowledge with your knowledge that you have acquired, you can already simplify situations for you to be prepared, for you to be ready, for the institution to be ready also in the admission of dengue hemorrhagic cases. Okay? Next, knowledge managers. For knowledge managers, the key term that can be associated here as knowledge manager is on processing collective expertise. So what do you mean by processing collective expertise? Class, when we talk about knowledge managers, in management process, you will facilitate to maximize the use of knowledge in planning, organizing, directing, and evaluating. So nurses are capable on plan, organize, direct, and evaluate. It is similar to the processes of nursing process when you are formulating your nursing care plan or NCPs. So, when a knowledge manager will consider nursing care plan that could be generic to everyone. For example, you're assigned in the intensive care unit. Most of the patient or specific ICU, surgical intensive care unit. So one of the basic role of a nurse who is assigned in the surgical intensive care unit is prevention of infection, of post-operative infection. Now, how you will manage it, how you will consider as knowledge manager, you need to consider, for example, the ICU has a bed capacity of 6. You need to plan if all the beds will be occupied, how you will manage your time. Next, how you will organize are the resources, the manpower are readily available in the institution, the contact with doctors, the use of the health information platform that could be accessible to authorized personnel. Third, you need to direct and do implementation. Whenever whenever you whenever there are 6 patients that will occupy that surgical intensive care unit, then how you will implement proper and quality care management. And last, the evaluation. As a manager, as knowledge managers, you need to consider if you have met your objectives or plan. So this will definitely benefit from the 6 patients that may consider as its maximum capacity or occupancy. The nurse could be confident because it will benefit all the 6 post-surgical patients because you have already planned, organized, direct, and evaluate. So those are knowledge manager. Kanina, in the knowledge users, the key concept there is valuable yung benefit niya sa individuals and groups. Pero ito, yung as knowledge managers, it will benefit a largest benefit. Largest, meaning it will benefit the patient, it will benefit also the healthcare providers who are nurses. Okay, next. Knowledge developers or generators. Sir, what is the difference between knowledge engineers and knowledge generators? Ang knowledge engineer can design a plan, can design a strategy, can develop and envision uh, possibilities. They can envision possibilities. Yan ang knowledge engineers. Hindi pa nangyayari, naka-design na on how to manage it. Yung knowledge managers naman, pumapasok yung apat na role niya, the plan, organize, direct, and evaluate on a process by which the nurse will maximize to benefit everyone or majority. Pag knowledge developers naman, eto usually mga troubleshooters ito. What do you mean by troubleshooters? What 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 the nurse planned may possibly be revised upon any circumstances or unexpected situations. So pag knowledge developers ka or generator ka, you can maximize all the knowledge that you have if ever the the objectives have not been met as planned. So this is now the time that you will explore and revise the care management. It is how you will embrace those changes that is happening to your patient. Because again, your priority is patient safety. And with this perspective, you can consider yourself as knowledge developers or generators. Sir, what's the difference po nito with the one that we have identified as knowledge workers? Yung knowledge workers, we gather data. Pero pagdating dito na sa knowledge generators, ang knowledge generators na po natin ay considering na po yung how you are translating the knowledge into wisdom. Kasi you are on a critical decision na. The changes that are unexpected are happening, what you can do about it. So these are the knowledge workers, acquirers, users, okay, engineers, managers, developers, or generators. Now, you can ask yourselves, where do you belong as knowledge, as nurses with full of knowledge? As knowledge workers, knowledge acquirers, knowledge users, knowledge engineers, knowledge managers, or knowledge developers. The 4, 5, and 6 has higher level of competencies. And I think, again, I will always say this to all of you. Whenever you will have your nursing research, if ever you will envision that you will contribute to the society and maximize your skills of developing something that will benefit the community and the people on the prevention or on the management of the critical diseases that will spread in the community, you could be knowledge engineers, managers, and developers. Okay? So next is the nursing informatics model. Okay, in nursing informatics model, what I told you in the initial part of our discussion, most of your responses in the question of do we prioritize or do we consider as a priority agenda ang health informatics? All of your answers is connected with the healthcare system. From the health centers to the hospitals to tertiary hospitals up to the Department of Health and other appropriate agency. That is the what we call healthcare system. And with the nursing informatics model, how can we now contribute? We can now identify the challenges and issues in healthcare system, but how nursing can contribute on the solutions, on the challenges and issues of the healthcare system. The areas wherein it will consider nurses to contribute on the concerns and issues encountered in the healthcare system is in education, practice, research, and administration. In education, nurses can basically integrate the knowledge on the and share can share knowledge and expertise on her experiences in health informatics, by which you can consider yourselves as as knowledge developers or generators, that you are now applying situations of preparing future professionals to be ready in the world where they will work, because it's a world that may possibly have already advancement. Now, since we're talking about the professional practice, then we are talking about the practices. So when a nurse is already working in any setting with any population group, it will consider the use of nursing as a way to connect with the solution of the healthcare system. Remote facilities are now being strengthened. Platforms are now available for our patients to secure health education. So I think these are evolution of how that the nursing nowadays will consider still at the bedside, but we can also manage even outside the healthcare facilities. Research is part of the nursing informatics model because most of the findings of researches can be utilized for what? For solutions. And the administration is important in this model because it will execute policies and guidelines. So in education, it will consider the preparedness and readiness of future professionals. Practice is it will guide those who are already in the professional practice. Nurses could be engaged into research so that to utilize the results and translate it into policies. And the implementers of those policies that has been considered as an outcome of research is through administration. We have discussed to integrate the concept of informatics in nursing and the healthcare system, because nursing and healthcare system are always there's no healthcare without nurses. And in nursing, it could integrate the use of the computer information science. We've mentioned the computer science considers on uh, the how we manage the use of the hardware and the software, while the information science entailed on our competencies pertaining to storage, to retrieval, to protection of information. And those once we combine all of these concepts from healthcare system, the nursing in these areas, computer and information science, this is nursing informatics model. It will still consider the basic knowledge on data, information, and knowledge, because data is a need to be processed when there is information available. Data cannot be processed without information. Okay? So that the information can be translated into knowledge. That's what we call transform. Why it is considered transform? Because the information will become more useful to nurses, and that will entail soon and become a wisdom when you are considering it for clinical decision making. Now, there are 5 key specialty areas. The 5 key specialty areas in nursing informatics are the following: clinical informatics, consumer health informatics, educational informatics, public health informatics, and research in nursing informatics. Now, we will proceed on the discussion one by one, and we will just have a very brief overview and go to the specifics on the next slides. Clinical informatics is more focused on how we manage individuals, on how we manage it's somehow patient-centered approach. We use the technology to manage personal information and medical records and health records of the patients. Number two, for consumer health informatics, this will benefit both the professional health practitioners and consumers who are the stakeholders or the patients. This is, for example, The hospital has hospital information system. The health professionals can access to the information of the patients. The patient can access to the services rendered by the hospital. So these are consumer health informatics. Most of the examples that we consider here is basic of the website of the hospital, where they can where each patient can gather basic information and services. The doctors can also gather information in the website to simply identify the laboratory services that the hospital rendered if ever they encountered a specific diagnosis or medical diagnosis. For educational informatics, this entail on what we are experiencing now in the digital world. It is on how we, as facilitators of learning, and you who are here in the Zoom room, benefited on the educational informatics. Fourth, public health informatics. The public health informatics is focused on the basic health services and initiatives that are cascaded in most of our communities. The setting could be health centers, at home, or home-based facility between the nurse and the client. Number five, research in nursing informatics. Research in nursing informatics, we have actually one of the centers or research centers in the country, such as RITM, wherein it can generate all those uh, information that could be translated into knowledge, and will consider these results as a basis for guidelines. Kaya before, the IATF, right? The IATF have set the health protocols with the help of the RITM, because most of the research findings have identified common symptoms of specific variants. Symptoms with Omicron, symptoms with Delta variant, and the comparative analysis as well. That is brought about by a facility such as RITF. So let us now proceed on the concept of why research is important and what is biomedical informatics. Actually, bio, life, medical, it's in health, and informatics is the technology. So the biomedical informatics are the use of the methods and techniques and theories. All in all of these concepts are being used because biomedical informatics are the sum of the basic research that we may have. Example, when we encountered COVID-19 pandemic, we have considered in biomedical informatics infection, chain of infection, on how the virus will be spreading from the host to another individual, and how it will definitely be transmitted, the means of transmission, the mode of transmission. It is part of the biomedical informatics. So that's why um, most of the most of our legislators have identified already the use of the face mask, the use of the face shields before, as a scientific reference to consider the strict implementation of protocols. So that is the product of biomedical informatics. Under the biomedical informatics is we have the bioinformatics. When we talk about bioinformatics, the focus is more on a cellular and molecular. Example, most of the variants of the COVID-19 have been easily detected because of bioinformatics. The RITM has its services. Another, um, they have identified individuals who may have a new variant because of the salient features identified in the microscope, or salient features that the patient had been recorded when it comes to signs and symptoms. Diba? So that's why most of the situations that happened before. Another, bioinformatics could be also the gateway in the implementation of the vaccination rollout, because it considered the importance of having these vaccines to help strengthen the immune system. And that is cellular and molecular. So that is bioinformatics. Now, from the biomedical informatics, we have the health informatics. That's why when I mentioned about clinical informatics, mas focus on individuals ito. Pag public health informatics, from the term itself, public, it's more on population. Pag consumer health informatics, it's more on the access of health information. And who may have the access of health information, as what I mentioned in the hospital, those professionals and those patients. Actually, sa consumer health informatics, some of the applications can be in a mobile phone or Android phone, or it could be through tools that could be institutional level. So pag institutional level ito, at ginagamit ito ng buong institution as a process of exchange of pre-exchange and sharing of information, e-health ang tawag doon. So pag sinabi nating mga electronic health records, electronic medical records, hospital information system, these are tools and services. E-health ang tawag doon. That is what I am attending now when it comes to the strategies and policies. Pag binabit naman natin, if you have encountered M-Health, pag M-Health naman, these are the basic applications that can be independently managed by someone who can have the access on the application. Example, if you wish to access for how many steps have you done, and that is only through the digital watch that is already integrated yung program. Another is um, the oxygen saturation. The oxygen saturation can be managed through a pulse oximeter, and it can already identify the basic vital signs that can alarm you soon. So these are the M health. Even another the normal weight based from the body mass index can be also be managed and computed through an application in M health. And this from biomedical informatics through this outcomes of M health and E health, these are outcomes from the basic research up to the applied research and practice. It is so called as applied research and practice because it translated already into a useful gadget or useful uh, means that will benefit the public. Okay, so it's 6:45. So before we proceed with the basic on the clinical informatics, um, we may have a 15-minute break as your health break. You may hydrate yourselves, have your early dinner so that to support our physiologic need, stretch your extremities so that to promote circulation. So we will be back at 7 o'clock. Okay, 7 o'clock after 15 minutes so that to finish the discussion on the 5 key specialty areas. Be back after 15 minutes. Thank you very much. Okay, BSN1, let us continue with our discussion. So, let us now start with the key specialty areas on clinical informatics. We have mentioned that in clinical informatics, the focus is, or the focus are individuals, well or sick individuals. That's why in this framework, if you have noticed, the core in the clinical informatics, as we mentioned, are the patients. And the use of the clinical informatics is embedded into the three systems. The clinical care is focused on how we manage the patient through the available information on the patient profile. Information technology is on the use of the technology and the platform in the processing of patient's information, and the health system itself is the combination of the individual-based care and the use of the technology and benefited the health system. It's all about the services, the health services that patient deserve. So in the clinical informatics, we have considered the perspective of how it will manage the use of the background where nurses decide accordingly because of the available information about the patient, from the results of diagnostic examination, from the patient's health history, and from the previous hospitalization. This entail on how nurses benefited from it because we can consider holistic approach and prevention as well. That's why when the nurse have the access on the clinical informatics, which is focused on the patient's health condition and history, then he could alert the other members of the health team when it comes to pharmacologic management. Because eventually, if it already declared in the patient history that the patient has hypersensitivity reaction on certain drugs, then the nurse can alert the doctors. Somehow, when we talk about clinical informatics, most of the nurses, most and high percentage of the administrators have considered in the selection of the platforms in hospitals, in any institutions, higher percentage of members are nurses. Why? Because nurses are always at the bedside, and nurses do documentation, and nurses do referrals and updating of the health condition of the patient 24 hours, every 8 hours, every shift. So that's why most of the nurses have been engaged into the needs assessment. They are being asked of what salient features must be expected in the platform that can be used by the institution. So selection committee, how this hospital, how these platforms can can definitely educate and train our nurses on its use. That's why if you can still remember the time that we discussed the uh, chief nursing information officer. So the chief nursing information officer is focused on the nursing services, specifically on nurses. Almost all nurses in the nursing service are being monitored when it comes to their needs, when it comes to the trainings, to upgrade their skills. These are more clinical informatics, since patient is the focus, nurses at the bedside are more responsible. Thus, when we proceed on the consumer health informatics, in consumer health informatics, I even mentioned to all of you that two two groups will benefit: the group of patients and the group of health professionals. For the professionals, we have the so-called professional health information system. This is the access of the professional or authorized personnel, healthcare personnel, on electronic health records, clinical report forms, those abstracts, biobanks, specifically those results of diagnostic examination, care pathways on the prognosis of the patient, and clinical decision support system, the input of the other professions for the holistic care management of the patient. So the healthcare process modeling, the feedback system, could be more efficient among healthcare professionals using the professional health information system. So may mga security tools naman yan. Ibig sabihin, each professionals will be given a code, each access will be given viewers rights. So still the administrator or the admin is the one specifically on the information chief nursing information officer's office is the one responsible to monitor the protection, because we are now protected with the provisions of the Data Privacy Act. The next question is that of, sir, the access of the consumer is the same for the professional health practitioners? No. The consumer health informatics application will consider on a perspective that can only satisfy the patient when it comes to the services and information that he may request. So it's by request. For example, the patient wants to identify all or wants to retrieve all results of diagnostic exam. So it will be up to the admin of the hospital or the appropriate office if the patient, through the authorization of the doctor, will be given access on those laboratory exam results. So it may depend. That's why if we talk about personal health records, those health records that are only useful for the patients, monitoring system is an example, vital signs that could be accessed by the patient as long as there is a proper instruction and information that could be taught to the patient. And yung personal health mobile applications, yung those that have been already installed. Kaya may mga hospital information system platform na it's already installed in their mobile phones. For example, if they will have a follow-up checkup, they could do reservations for consultations using the mobile applications of the hospital. So the feedback system is more on the patient work framework. So patient talaga. And the healthcare process model is more on the professional health information system. So ang maganda dito is pwede po bang it may cause po ba exchange of information from the patient to health professionals and health professionals to patient? Yes, that could be possible through the use of these platforms. Just like in the Neo LMS, we do have the chat group, do have the forum. So similar with the consumer health informatics, patients and doctors can exchange timely information using the consumer health informatics. And usually, ang most for the consumer health informatics are focused on the health promotion, disease prevention, self-management, and patient-centered care. For consumer health informatics po, patients could have an independence when it comes to the access of information. Example, even tayo, when we want to know information, basic information about a certain disease, we can use the search engines just to have those information. So similar for those patients who wish to know basic information about the institution, basic profile of the doctors, specialization of doctors, and those services of the hospital. So indeed, we can consider also, actually in the consumer health informatics, it's more on the satisfaction of patients when it comes to health information. Kaya it's self-paced self-paced. Just the same as for us, who can have the self-paced na we can just uh, go to the Google and search for the basic information. Ito naman po, exclusive mga platforms ito that can be uploaded or that can be downloaded or can only be peculiar platforms or applications in a specific facility or hospital. So, in consumer health informatics, these are the three outcomes of the consumer health informatics. Sa telemedicine naman, ang telemedicine is different from telemonitoring ha. Ang telemedicine is, for example, patients may not proceed to the hospital, but the hospital will maximize its resources to reach yung delivery of services at home at distance. Example, in telemedicine, it can consider po yung kasi part of the telemedicine is the teleconsultation eh. So it can use a platform that can facilitate e-prescription. Yan, telemedicine yan. Kasi the patient do not need to proceed to the clinic and avail for the prescription, which is acceptable na po in most of the pharmacies and other pharmaceutical facilities. So, telemedicine also, yung mga laboratory examinations, laboratory exams that if the patient is not capable of going to the hospital, so meron tayong mga tinatawag na mobile diagnostic examination, mobile diagnostics that can proceed to your communities. So these are telemedicine, yung services that can proceed to distance. Ang telehealth naman is more on the interactive. For example, sa telehealth, the patient was instructed to identify alarming symptoms. So dito, pag sinabi ng doctor, okay, access the telehealth portal and you can see their basic information on alarming symptoms for you to proceed immediately to the hospital for immediate medical care. So nandun yon. It's self-management. The patient can already access those educational materials. So parang similar with our Neo-LMS. If the patient has the viewing rights of all the available materials, he can view and access it. Sa telemonitoring naman, ito yung for example, yung results of the diagnostic examination can be can have an interpretation through a digital format. The digital format can be accessed by the radiologist to have the interpretation of the the plates if it is on radiographic studies. Another is kung ito po ay ECG, so the doctors can view specifically yung strip, yung ECG strip and can have interpretation. Kung angiogram naman ito, yung movement ng heart, the video will be sent to the doctor and will interpret it. And even though the doctor may not proceed to the physical facilities. So yan naman po yung mga tele-monitoring. So these are the typical examples that we have in consumer health informatics. Ito yung mga health education website. So DOH is one. Web health forum. So nurses, doctors, patients can do interactive session in web health forum. Patient portal. Patient could be given with with codes, and with those codes they can access the portal and basic information about themselves, their health condition, which are readily available in a portal from a specific facility. Yung fitness tracker application ay ito naman po is this could be downloadable, which can give basic information. Example, it could already identify through the digital watch oxygen saturation, the pulse rate, the blood pressure, even the weight can be already identified. Body mass index can be computed already. So what is the recommended daily allowance for food content? So these are the fitness tracker application which is identified for consumer health informatics. Now, when it comes to the educational informatics, I know all of you can relate. All of you can be connected with me on a perspective that learning and teaching had been possible in the last 2 years through the use of the various platforms, educational platforms. And I think that the basic information science is the one that really been considered as a foundation. Kasi the exchange of information can be done through electronic and digital way of exchanging information. So it could be asynchronous, it could be synchronous. So the flexibility itself is the benefit of the educational informatics. It is not just only on educational institutions. It also considered those nurses who benefited from continuing professional development. For those who wish to have to renew their licenses, they can already have the continuing professional education units through webinars. So even though they are not physical, they will not physically attend to those face-to-face workshops, trainings, but they could still earn through webinars. And these are the outcomes of what we call educational informatics. This is how the learning resources are readily available. Kaya nga Even before may mga modular method na nga siya. Pero yun kasi it's the physical and the printed modules can be retrieved. Pero ngayon, modules can be retrieved na lang. Ang typical example niyan sa TESDA. Sa TESDA, 'di ba? Most of the ano na lang ngayon can complete their courses through online, then they will just proceed for demonstration for I think 1 or 2 days only. So those are a typical example of educational informatics. Let us now proceed with the last two. The last two is more on the public health informatics. We have mentioned that the focus of the public health informatics are population groups, right? So that's why if you will notice, most of the services available, ito na po yung may mga established na health information system. This is according to the Center for Disease Control. Disease reporting, kaya nga ang World Health Organization, even the Department of Health can already have the updated, updated reports of diseases. Outbreak management, it can already identify specific location. Pag the number of cases can already considered outbreak, so that to prepare hospitals. Cancer registries, we can already identify that the leading cause of cancer for Filipinos, male or female, children, adult, and elders. Because of this registry already, may mga hospitals tayo that are already mandated to have these records. Risk factor of surveillance. Ang risk factor surveillance, ayan, ang typical example dyan, contact tracing. And di ba the outcomes of the COVID-19 pandemic is the tracking device, the tracking application. And the newborn screening is the results can already identify reports for abnormalities or deviations that have been identified in newborn screening. If you will notice, it's progressive. It's a process from the time that if a nurse identified the specific problem in the community, he can conceptualize. Eto na papasok na yung pagiging knowledge engineers nyo. Kasi, okay, we have outbreak of measles. If we have outbreak of measles, okay, let us design a plan on how we could reach the family members on how to manage measles at home. And those who did not manifest symptoms of measles, they will be subject for the vaccination. So other than that, when you have the design, you will develop. Develop meaning you will identify the resources that will be needed for implementation. Kung ready ng all of the resources, implementation. Then after the implementation, you need to evaluate so that to have a continuous process of implementation and maintenance. Maintenance meaning this will be the regular healthcare services. Kaya if you will notice, most of the health centers na may established na public health informatics, may continuity na sila at mas efficient na yung services that they are providing kasi there are some instances that nurses and doctors are the ones who are already doing the home visit kasi they have already identified areas na may outbreak, they have already identified the families that may need assistance at home. So yan yung public health informatics. And usually, it considered yung concept po natin ng community health information, community health nursing, epidemiology. Pag sinabi natin epidemiology, this considers yung tinatawag nating vital statistics. If you've heard about mortality rate, morbidity rate, we can already centralize the information related to it kasi we have already the tracker, we have already the applications that can facilitate the storage and retrieval of information. Then, we have the Centers for Disease Control and Prevention. Here in the Philippines, we have RATM. But we have a pending bill po na sana it will be enacted into law na magkaroon na rin tayo ng Center for Disease Control and Prevention kasi ise-centralize na dito yung ise-centralize na basically yung mga information on data analytics. So hoping this could be helpful na. And I think that the benefits of public health informatics is yung nakakapag-build tayo ng network that will help the population on awareness. Tapos, information exchange service. Ito yung, for example, within the regional, yung most of the example that I gave to yung when the patient had the prenatal check-up in the province, but she delivered in the city, wherein she was identified with high-risk pregnancy. So to track those information exchange, you will just be given the viewing rights to access those information. Biosurveillance programs, ito po, these are usually mga diseases, outbreaks, at mga identified diseases in the community that will certainly will give you, kasi di ba nga pagka if you can still remember sa IATF may alert level system, yung level 1, level 2, level 3, level 4. Pag-increase yung number of cases, nagle-level 4, tapos may specific protocol. Yan yung biosurveillance programs. At yung letter D, vital statistics, this will improve really yung collection of how many infants have congenital defects, how many pregnant mothers have anemia, how many male fathers. Okay, syempre male fathers. Father, syempre male. How many fathers in the family have pulmonary tuberculosis? Yan. That could easily be efficient through the use of the public health informatics. Kaya ito yung mga tools, these are the tools that are already available. May electronic medical records pero hindi lahat ng mga facilities yun. That is the sad part. Not all healthcare facilities, health centers do have the electronic medical record. Malay nyo, may mga health centers po tayo na wala pang established na electronic medical record at kayo po inyong research ang mag-provide nung ganung system doon sa health center na yon. That could be a legacy. So hoping this could be one of your research concepts. So another is, for example, mobile-based system surveillance. Pag sinabi natin mobile-based system surveillance, ito yung mga situations wherein i-alert nyo yung mga families pagka may mga risk na for calamities and disasters. May application lang yan. It will alarm yon. And another is electronic lab information. Ito na po yung wherein it will access yung basic reports of laboratory exam, even on a certain level lang, sa health center lang. Ito yung mga mga available services. Pwedeng shared services to ng pharmacy, diagnostic laboratories, tapos hospitals and health centers. Now, in research, as the last key specialty area, we'll consider po yung systematic method on how to use this information and analyze. Once the information had been analyzed, it turned into translation of how it will be useful. Ito po yung model in research in informatics. We have the healthcare system that is now existing. We have the population health, which may benefit the population groups, and research centers. This is the one that I'm emphasizing to you na aside from RITM, may mga centers for or disease prevention and control tayo na ma-establish so that it will be the center. Meron pang isa National Center for Geriatric Health na hindi pa siya nai-institutionalize kasi part pa siya ng Jose Reyes. Pag ito po ay maisabatas at mai-lobby accordingly, pag ang National Center for Geriatric Health ay ma-establish na at maging training and research center, ayun, lahat ng mga concerns related to geriatric health and conditions can be useful on this research in nursing informatics. There are many benefits that will help the Department of Health, that will help the Department of Budget and Management on manpower, human resources for health, that will benefit the public as well. So I think that's the end of the discussion for this evening. I'll just stop the recording.